Hi, I'm Tim Hayden, President and Co-Managing Partner of Brain+Trust Partners, proud sponsor and co-host of the Consumerizing the Healthcare Experience track at Health Further in Nashville, Tennessee later this month. I'm sitting here with Brian Manell, who is the CEO and co-founder of Wearables. Brian and I will be sitting on stage having a fireside chat there at the festival, Health Further, talking a little bit about what's happening in the wearable space, data, and how the patient really, from a larger trend standpoint, is now in control or soon to be. Brian, thanks for joining us. Thanks for joining us in Nashville.
Good to be here.
Let me just ask you from a high level standpoint, what do we see from a trend right now in terms of how people are starting to make sense about their conditions based on data that they get from wearables? Before they go to the doctor's office, maybe as they are communicating with anybody who's a part of their wellness.
Right. I think people are more informed than ever about what's going on with them. Thanks, of course, to the internet and lots of information out there, but also the community and forums and groups where people aggregate together, talking about whatever it is that their health concern is. As well as the data that's collected from their devices too, they're bringing together. So people have more tools than ever to understand what's going on, maybe before they set foot in the practitioner's office. Sometimes it's a good thing or a bad thing, right?
Right.
Sometimes you over-research and over-worry sometimes, but there's more than ever, and more coming. Like, it's just changing rapidly every day.
Absolutely, it is. Absolutely, and I want you to tell us a little bit about what's happening in the space of how companies right now are wanting to be able to take a look at the data that's coming from wearable technology, specifically smartwatches and some of the other devices that we use mainly when we work out or when we're moving around, but some which we wear 24 hours a day. How is this changing the interest or the access that people have to information about humans, and what kind of decisions are they making based on that information?
Yeah, the devices are just exploding, right? This whole consumerization of healthcare trend is putting smart devices on our wrist that can sense our activity and motion, sleep, heart rate, and all kinds of things. And there's only more and more sensors getting packed on these all the time to sense blood pressure and all kinds of things. One of our beliefs is that this data is still a little bit siloed, right? It's collected in a whole bunch of different places that people don't really have control of necessarily. So, one of the things we're working on is how to create tools to collect all that data and empower people with it a little bit better, correlate it, share it, compare it, contrast it, do all kinds of things with it, to try to make it a little bit more useful than what it is today.
Excellent. Let's talk about empowering people. This data has value, and I know that Wearables is looking at ways that once you've collected that data, you may be able to not only anonymize it for others to use it, but to have it almost have a market value for companies, for people in the healthcare, players in the healthcare space to come in and have access to that kind of information. What are you guys doing, and what do you think the future looks like?
Yeah, so we think that data has huge value, right? So if Facebook's data about what you like and things you follow and those sorts of things are worth $50 billion a year in ad revenue and sales, and Google's search data is worth $100 billion a year in search value, then this very personal data about me and what I do and my steps, activity, what I eat, consume, walk, what sort of conditions I might have or be battling, we think that data is even more valuable.
Right.
But with the capabilities coming in blockchain technology and tokenization, it's possible, we think, to tokenize this data and have the wealth and the value of that data be in the hands of the people whose data that it is. So we're in the very earliest stages of how to do that and build that wealth in a more decentralized way, not in a big, massive Facebook or Wearables, right? But amongst the people whose data that it is, the technologies are really just now becoming available to do that.
Right. So we look at the opportunity for tokenization and ultimately monetization, right, of data, and that being the power that goes into the hands of the patient or the customer, right? And as a marketer, I see that all the time for all the reasons you already stated. The breadcrumbs that people leave across digital media allows me to understand more about their behavior and be able to serve advertising up to them, or to show up in the right place with signage, a promotion, whatever it may be. How does this change the doctor-patient relationship? How can it change the relationship between those who care for us and our wellness and all the data that we seem to be having access to, and soon to have a better, I would say, thumbprint of our wellness and the reasons we're in the condition that we are, good and bad, in a pre-diagnosis context? What does that do in terms of changing the dynamic between how we go to the doctor, how they diagnose us, beyond just taking our temperature and blood pressure?
Right.
Right.
Every time I go to the doctor, they weigh me. Like, what does that really tell anybody? I don't really know. You'd think they'd be more interested in data that they don't have readily access to, like how active am I in my life? Am I getting activity and motion in my life? What kinds of things am I eating? What's my diet like? What kind of sleep am I getting? How well do I hydrate each day? You'd think they would want to know these things too. And this is becoming possible, right? To harness this more environmental data about what we do and then bring it to the practitioners. And then, as I talk to people anecdotally about this capacity of bringing this to our medical practitioners, I hear two very divergent stories on the possibilities for that. One that's on the negative side, which says that the general practitioner of today just does not have the time to go through all this data during your appointment or before your appointment.
Right.
The number of minutes a doctor spends with the patient is very low.
Right.
And in many cases, you're talking to the back of your doctor's head because they're typing into the EMR system all the required stuff they're required to do to get paid for your visit. So it's not really, very interactive. On the positive side, what I hear from people is that there's a hope that the younger generation, the Generation Z or whatever you want to call it, is going through medical school today.
Right.
Is used to sifting through tons of information, is used to taking data, visualizing it, and those sorts of things. And so the future potentially is that we can bring all this data to our practitioners and then be able to use it and perhaps apply great tools, maybe in some AI models or machine learning, to help them sift through all this data and tease out some insights that might not be obvious to people as well too. So I think the future, I think, has great possibilities.
Right, and I agree, and I think you and I've talked about it before. It's just students that are in med school today. It's what we see when we try to wrap our heads around millennials, Gen Z, all these changing behaviors, and we try to explain it in terms of these direct-to-consumer models, these convenience models that we see brands bringing to market today. But truly, there is a different capacity to absorb and digest information. Am I right?
Yep. And display, visualization information. All the
Right.
tools are getting way better in doing that today than ever before.
That's right. We see it in marketing in terms of being able to make sense of the billions of data points that are out there every day, and certainly that's going to come to bear in the medical and the healthcare space.
Absolutely.
Absolutely. Well, thanks for joining me today, Brian, and thanks for joining us in Nashville.
Yeah, good talking with you. See you in Nashville.
Looking forward to having you on the stage there and sharing it with all of you at Health Further on August 29th in Nashville, Tennessee.